Hi, my name is Kent Johnson. I work for LA Sports Performance Care, and this is my model, LA Man. And we're going to demonstrate standing lateral lumbar and cervical flexion. And this exercise is great for any patient that's experiencing any sort of spine immobility / pain, or athletes that need increased spine mobility or rotation. The way this works is, one of the key points is Ali needs to stand in a neutral position with her spine extended. She's going to have her feet in a neutral position. That means her feet underneath her knees, knees underneath her hips. And now she's going to just keep her arms down by her sides. We're going to do them two ways. One with arms down by your side, and the other one with your arms abducted at 90 degrees. We're going to start with the first one, arms down by your side. Now Ali's going to stand up nice and tall and laterally flex her lumbar spine to the left. Now while she's in that position, she's going to go as far as she can, so you're going to push a little bit. Now she's going to laterally flex her cervical spine. Back and forth. And she's going to do that 5 times. Good. Alright, and then she's going to go ahead and do the other side. As far as she can. There you go. So you're going to check in. In the beginning, it may seem a little threatening to do this, to actually stretch your spine this way, and you have to think in everyday life, you don't get much opportunity to go ahead and do this. Now, in that demonstration, she laterally flexed to one side, she held that position, and then she laterally flexed her head 5 times. What you can also do is go ahead and keep your arms down by your side, laterally flex to the left, and laterally flex your cervical spine once each time, and then come back to a neutral position and then laterally flex to the side again. Okay, and that also allows you to go ahead and incorporate more movement in your lumbar spine. Okay, now this is both a strengthening exercise and a mobility exercise. One side of the obliques or the spinal lateral flexors are actually contracting and pulling the body over, and the other side has to let go. And then when you actually come back to a neutral position, those muscles also have to engage to pull you to a neutral position. Okay? Now she's going to demonstrate how to go ahead and do this with her arms abducted. Okay? Now patients that have, go ahead, patients that have any sort of significant upper trapezius or cervical or shoulder discomfort or limitations should not do this one. They should stick with the first one. Okay, and this is pretty simple. Everything is pretty much the same. Good. And this is a great exercise to go ahead and repeat throughout the day and just keep your spine loose. Okay, good.